change it.
In order for our businesses to thrive, we need a healthier and productive workforce. And for that to occur, you need to have wellness programs that are deliberate to ensure that your employees are performing at the best they can. As we think about men's health today, you can think about the problems that are associated with employees. Particularly, we have noted an increase in problems associated with men. As you can see, the key issues there: workplace struggles, stress and depression, children, dependent parents, personal losses, alcoholism and substance abuse. Men, we have found that they have difficulties in relating to these and also dealing with them, because men by nature do not like to talk about their problems. So with our interventions, we particularly zero in on all employees, and men are not left behind in helping them to become productive, because absenteeism due to any of these factors has been killing our businesses. More than 20 billion a year is lost in terms of the costs of absenteeism. So our solution, we focus on 8 dimensions of wellness as a Velocity Wellness, which is a total wellness package where we encompass everything to do with the human being and how they can perform at their best at the workplace. So you can see that from our solution. The next slide there just gives you our capabilities in terms of the things that we are able to do as Velocity for any of the companies that we are partnering with in their wellness programs. We offer a 24-hour counseling call center where employees and their immediate family members are able to speak to a counselor and be assisted. They could also have a facility to do face-to-face or group sessions. We have links with various specialist services across the country, and we do periodic wellness assessments. We can also do fitness classes, and we have a mobile app, and we have e-learning portal where employees can learn, because the first port of call has to do with awareness. So we've got that in our programs. And then one of the things that I love so much about our programs is the rewards program, which enhances or rewards employees for positive behavioral changes. This we have found it useful indeed. So we have coaching, mentoring, training services, a monthly newsletter, promotional materials. We can discuss orientation and substance abuse management training programs, critical incident stress management. All of these are part of what we provide. And those are our details. You can call us and we can discuss with you, or you can get in touch with us, and then we see how we can better help you and your employees to perform at the utmost best of each employee. And we are proud to be part of this webinar this afternoon, and we are looking forward to a wonderful time together where we can all come out having learned something. So thank you, Mason, for the opportunity to partner with Familia Africa. We are excited. We are looking forward to many more things coming.
Thank you, Ed, for that introduction of Velocity Health. Our other partners in this particular webinar is Indoda Health. And please ask Dr. Gerald to just briefly say something about Indoda.
Thank you very much, Mason. Good afternoon to everyone. My name is Gerald Mataruka. I'm a medical doctor. Been working as a healthcare practitioner for close to 8 years now, and have been working in sort of the men's health space for over 3 years. So I'm the founder of Indoda, and basically at Indoda, our motto is choices to health. So we basically want to empower men to make correct health choices that will benefit them. So we've got a very vibrant team at Indoda, and there's a lot of things that we're going to be working on in the coming few months that are exciting. But essentially, we focus on breaking stereotypes around men's health, and also sharing a lot of insights and knowledge and things that will actually empower people and giving people resources to know more about their health. So to get in touch with us, if you want to find out anything, or you want to know more about what we're doing, or if you want to partner with us, it's very easy to find us. We are on the socials, so you can find us on Instagram, and our handle on Instagram is Indoda_wellness. You can also find us on Facebook. So you can find us at Indoda Health and Wellness on Facebook. You can add us as a friend there, or if you just search at Indoda Health on Facebook, it will take you straight to our page and give you more details about us. And then if there's any formal communication which you'd like to communicate with us, you can drop us an email at indodahealthandwellness@gmail.com. So briefly, that's about us at Indoda, and it's easy for you to find us if you want to. But just keep watch out. A lot of exciting things will be coming from Indoda, and really will benefit a lot of men and women, because it will benefit the men that are in their lives. Thank you.
Thank you, Dr. Jerry. We will be hearing more from you shortly. Now, ladies and gentlemen, I say ladies and gentlemen because we also have ladies in our presence, and this is a webinar that cuts across both divides. Yesterday, I just celebrated my daughter's birthday. She just turned 12, and there's a whole lot of years ahead of her. Now, one of the things that is dear to my heart as a man is I want to live long in order to be able to walk her down the aisle. Now, you may be a man, or you may be a lady with a brother, a husband, a friend, or a colleague, and men's health issues are also dear to you. Now, I would like you in the chat section to just type your expectations for this webinar. I'm going to type, I'm looking forward to knowing how to ensure my life lives in order for me to walk with my daughter down the aisle. Maybe your expectations are on mental health issues. Maybe your expectations are on some other issues that are bothering you as a man, as a wife, and so on. So I would ask you to just jot them down on the chat session, and we'll be able to have in our question and answer segment Dr. Mataruka as well as Ed Masao responding to some of those. And again, as we continue, I will ask the Velocity team to share also the toll-free number that we can also get in touch with them in the event of further inquiries coming on maybe you need counseling, or maybe you know someone that needs counseling. Without any further ado, ladies and gentlemen, I have just a short video to share with you before our main speaker comes on board. ladies and gentlemen, shift happens. And today we take the first step by recognizing all the men, celebrating them, and asking them to take their health seriously. A lot is at stake, a lot depends on it, and we ask all men to start the shift now. Our main speaker, ladies and gentlemen, is Dr. Gerald Mataruka, a medical doctor by profession, and is the founder of Indoda, a health and wellness initiative focused on empowering men to make better health choices. He's a speaker and a health educator. His interests are in men's health, prostate cancer, and many others. And yes, he's also a seasoned golf player. Without any further ado, ladies and gentlemen, Dr. Gerald Mataruka, over to you. Dr. Jerry, you may want to unmute your mic.
Hello, hi, can you hear me? So thank you, Mason, for that very, very generous introduction on me being a very seasoned golf player. Okay, so I'm just trying to share my screen for my talk. I think can the host just change the settings and allow for participant screen sharing, so I can share my screen, please.
You can try now.
Yeah. Okay. Can everyone see my screen?
Yep.
Was there an affirmative? Okay, yes. Great stuff. Okay, so welcome everyone to our Men's Health free webinar. And I'd like to wish every man who's here on the platform a happy International Men's Day. And I hope going forward, you would live a very fulfilling and healthy life and have a great impact in your spheres and with your loved ones around you. As introduced, my name is Gerald Mataruka. I'm a medical doctor, and I'm also the founder of Indoda. So whenever I think of men's health, you know, this sort of image comes to mind where you basically, you know, you've got a picture of these dark, gloomy woods where, you know, there's not a lot of light. You don't know what's happening in that area, probably slightly abandoned, probably an area that you are, you know, you'd be worried or scared to delve into. So this is the kind of picture that I have when it comes to men's health. And I think this is the state of our health for men in general, especially in this country, that it's sort of perhaps maybe an area that doesn't have a lot of light and don't appreciate some of the challenges that they face, so they don't mitigate those challenges effectively, and it impacts their life. But yet, you know, imagine you take this very same picture of these woods and you to just add a bit of light in there. And with more light, these woods that are dark and gloomy can actually turn out to be a very scenic and serene area where you'd like to be. So hopefully this is where we'll be going. So the outline of my talk, so I'm going to touch on 4 main areas, being mental health. I'll also touch on cardiovascular disease. I'll also touch on erectile dysfunction, and I'll finish off with prostate cancer. And then I'm hoping at the end that there'll be a lot of questions, and then we can engage with each other on the questions. So mental illness, so this is something that is very important, and I feel is very much neglected and very misunderstood or ill understood. So hopefully, you know, we can move to a place where we understand and appreciate mental health issues much better, so that we're able to support those who are suffering from mental illness, that they would be able to return to productive lives, and that their well-being will be taken care of. So I'm going to start by talking about depression, and I'm going to look at depression specifically by looking at the statistics that are here at home in South Africa, because sometimes we talk about these issues of mental health and we think that perhaps we're talking of a first world problem, something that is far from home, is difficult to relate to. But we'll be looking at it from South African perspective to bring it closer to home. So 10% of all individuals, 1 in 10, there's a 1 in 10 chance of suffering a major depressive episode at some point in your life. So that is quite a high statistic if you were to think that at some point in their life, 10% of our population would be battling with depression. And then for those who are in an urban setting, that figure of 10%, it actually jumps to 25%, and actually shows us that there's a lot of issues that we are facing and a lot of pressures in urban dwellings that make us susceptible to suffering from depression. And then also, depression has been found to be more common in lower income groups, something that is slightly counterintuitive, because sometimes we tend to think that depression may be an illness for those who are affluent. So the age group that is at highest risk for suffering at depression is actually the age group of 40 to 49 years. These are the guys who are at the highest risk. And it has been found that men who are over the age of 50, they suffer the greatest number of days out from their depression. And then these is actually 3 times as much as their female counterparts in the same age group. So we can see that the burden that is suffered by men when they're depressed is actually much greater. And then also, it's been found that if you're suffering from a major depressive episode, you would be in a non-functional state, not able to continue your day-to-day function, whether it's at work or at home or even in a social circle, for up to 57 days. So that is 2 months. So you can see the strain of suffering from a major depressive episode can have on the individual's life, not only on the individual, but also the loved ones who are around that person. So there's quite a few of challenges that exist when you talk about depression. So I think, especially in the Black community, depression is misunderstood. We don't understand depression very, very well. And we see this in the way that we communicate on a day-to-day basis. So whenever you see someone suffering from depression, the commentary that comes out from the people who are around that person, you hear things as people saying such as, no, depression, it's a white man's illness, or, they're like, but what's depression? We don't have those things of depression in our culture, so there's a lot of misunderstanding of mental illness and depression, especially in the Black community. And then also as well, there's quite a lot of stigma that exists for men who suffer from depression or mental illness. As in, if you are to suffer from mental illness or have a depressive episode, some people would view you as being weak, you're an inadequate man, you've sort of somehow failed. But yet we fail to recognize that this is actually an illness. Someone is actually, suffering from an illness like you can suffer from any other illness, so there's quite a lot of stigma. And I think for us to get this right, we need to break some of that stigma. And then we also see that another challenge is that men, they are very, very reluctant to seek for help. And when they do seek help, it tends to be very, very late. And I think that is a challenge, not just for mental illness or depression, but almost for all illnesses, and something that we need to break down, because the earlier you seek for help, the quicker you can be helped and actually start on the road to recovery. So this is something that we need to work hard on. You saw my previous statistic where we said men, they can actually have more downtime from suffering from their illness, up to 3 times compared to females of the same age group. So there's a lot of myths that exist surrounding depression. Some, like, it's only an illness for people who are affluent or rich. You hear a lot of things. If someone is going through something, you hear people saying, no, Indoda Dr, men don't cry, just be strong. And sometimes you can find someone who's suffering from mental illness, and people like, no, he was bewitched. But we fail to recognize that actually, no, this is an illness that can be treated and attended to. Even in Christian circles or religious circles, you hear people saying, no, just pray and, it will all go away, it will all be fine. But we fail to realize that people who are suffering from this, they need more support. Another one is that successful people cannot be depressed. So there's a slide that is borrowed from the USA Mental Health First Aid. So basically, it's just highlighting the signs and symptoms of depression. So to diagnose someone as being clinically depressed, you need at least one of two main symptoms. So if you look at the top left-hand corner, the symptoms of sad mood or loss of enjoyment and interest in activities that used to be enjoyable, you need one or two of those symptoms to be present. And also you need those symptoms to be present persistently for at least a 2-week period. So if those symptoms are present for at least 2-week period, then we can start saying, actually, this person is depressed. It's not just you just had a bad day, so you are sad today. No, it has to be there for at least 2 weeks, the time frame. And then on top of having one of those two symptoms, you need an additional 4 symptoms that are listed on the screen. So symptoms such as lack of energy and tiredness, having feelings of worthlessness or feelings of guilt, having thoughts of suicidality, also as well, difficulty in concentration, also sleep disturbances, whether you're failing to sleep or you're sleeping too much, loss of weight or gaining weight, and loss of interest in food or loss of appetite. So you need these symptoms to be present for at least a 2-week period, and then we start talking about this person is actually clinically depressed. So how can we recognize someone who may be suffering from depression, or even amongst ourselves when, if you're worried about yourself? So, if you see someone who's probably, engaged in absenteeism, in their workspace, we probably need to worry about that person. Someone who is now using an increased amount of substances from what they are used to, whether it's recreational drugs, alcohol, or even if it's something like coffee that, you find someone is taking more and more for them to just be functional, we need to worry about that person. Someone who's withdrawing from social events, social gatherings, or just from personal interaction, we need to worry about those people. And then let's also remember the signs. Let's keep the signs in mind so that we will be able to recognize depression and assist those who may be suffering from it. To touch on suicide, so we've got a very high rate of suicide here in South Africa, and we actually rank number 8 worldwide in terms of our suicides. So each and every single day in South Africa, you have 230 people who attempt suicide, and of which, out of those 230, about 23 of those people will actually die from suicide. So this is a big problem. These numbers are daily numbers. So you can see, if you're to accumulate them for the entire year, you see how much of a big problem we're actually faced with. And we also know that men are 3 times more likely than women to commit suicide. So this is a thing that really affects men, and we need to be there to support each other and be there for each other as men. Substance abuse. So at least 15% of South Africans have a drug problem. And then the commonly abused substances would be things such as alcohol, cannabis, tick, cocaine. And then substance abuse, it plays a significant role in depression and other mental health illnesses such as mania, psychosis, anxiety disorders, and others. So substance abuse actually contributes and exacerbates the problem of mental health illness. So it's very important, you know, we can sort of now get a better idea of what depression is, or get a bigger picture of how big the problem is. So it's very important that now that we are becoming more and more aware of this, that we actually know where to go and get help, so that we can actually direct people who are suffering from some of these conditions in the right places. So here I've actually listed some helpful organizations that would be able to attend to someone who perhaps maybe is depressed, or is thinking about committing suicide. So these are some helpful organizations that one can contact. And most of these organizations, they've got 24-hour contact services or helplines. So there is someone out there for you who's willing and able to help you. I think that's what we really need to take out of this, that there is help if it's needed. So let us be aware of these organizations and keep that in mind. So I'm going to move on from mental illness, and then I'm going to touch on cardiovascular disease. So this is another very, very big subject, cardiovascular disease, that we are also doing very badly in. So you'll find that the leading cause of death worldwide is actually cardiovascular disease. So this is the one thing that is claiming most people in the world. So it's got a great burden on us. And more than half of these deaths, they occur in people who are less than 65 years. So we tend to think, oh, cardiovascular disease, that person had a stroke, he had a heart attack. We think, they must have been old. But actually, even in young people who we expect to be functioning at the peaks of their career and their contribution to the economy, those are the people that are actually even suffering from some of these things. And it has been found by research that up to 80% of these deaths are preventable just by doing three things, just by three simple things: having a healthy diet, exercising regularly, and stopping smoking. So if you could do those three things, you actually, to a large extent, can prevent the risk of death, and you know, on a personal level, decrease your chances of actually dying from cardiovascular disease. So bring it to home. So in South Africa, cardiovascular disease is actually the leading cause of death after HIV and AIDS. So it ranks as number 2. So it's, again, causing a big burden even in our population. And we know that 1 in 6 South Africans will die from cardiovascular disease. And each and every single hour in South Africa, we have 5 people who are suffering heart attacks, and we have 10 people who are suffering strokes here in South Africa every hour. So you can see a lot of people are suffering from this. If you were to tally those numbers and accumulate them, you see a lot of people are actually dying from these illnesses. So high blood pressure. So high blood pressure is actually, you know, it's termed in medical circles as the silent killer. Because high blood pressure, you can suffer from high blood pressure and have high blood pressure for a long time, be asymptomatic, but yet you are suffering from organ damage and death is near and is close to the door. So the main risk factor for death in cardiovascular disease is actually high blood pressure or hypertension, you know. And in South Africa, we've got the highest rate of blood pressure in the world for individuals who are greater than the age of 50. It's been found that half of all strokes that occur and about 42% of heart attacks, the primary cause of that event was high blood pressure. And 1 in 3 South Africans have got high blood pressure. So we can see how common it is. And again, this is not just a problem of the elderly, because even in children, we know that up to 10% of children are suffering from high blood pressure. So obesity. So about 1/3 of men in South Africa are overweight, and about more than 1/10 of them are actually clinically obese. So if you want to know if you're overweight or you're obese, you need to calculate your body mass index, and you do that by taking your weight in kilograms, and then you divide your weight in kilograms by the square of your height in meters. So for example, if you are 75 kilograms and your height is 1.6 meters, so to get your BMI, you'd say 75 divided by 1.6 times 1.6, and then you'd get a figure that would give you your BMI. So you'd know whether are you overweight and are you obese. The cutoff for being overweight is a BMI that is greater than 24.9 up to 30. And then once your BMI is greater than 30, you are actually obese and you're at a great risk of cardiovascular disease. And then also another useful metric that we can measure is your waist circumference. So all you need is a simple tape measure. You put it around your waist at the level of the navel and or your umbilicus. And then in men, if your waist circumference is more than 102 centimeters or 41 inches, and in females, if it's more than 88 centimeters, you've got an increased risk of cardiovascular disease, and you need to address that. Another one is cholesterol. So in layman's terms, cholesterol basically is one of the fats that you find in the blood, and it's there normally. If you've got elevated levels of blood cholesterol, this could lead to what we call atherosclerosis, where basically you have deposits of these cholesterols that are normally in the blood. They start accumulating along the wall of your blood vessels, and through a chronic inflammatory process, those blood vessels end up blocking. And that's what would lead to you having events such as having a stroke or a heart attack. So up to 25% of South Africans have got high cholesterol levels. And the majority of our population are actually unaware of what their cholesterol levels are. So it's quite scary. Diabetes, we all like a little bit of sugar. So 1 in 10 South Africans suffer from diabetes. And of those 10%, half of them are actually unaware that they've got diabetes. So these are the people who are actually in the greatest danger. If you know, it's good because you can take steps to address it and you can be on treatment. But if you're unaware, that is when the disease process is ongoing and would lead to complications very soon or even at a later stage. And then we know that a further 20% on top of that 20% are what we call pre-diabetic. So they are just on the fence, they're just about to be diabetic and they've got impaired sugar levels, so that is also a risk group that, that we also need to identify, so that those people can actually make changes to, so that they address that risk factor. So smoking or tobacco use. So we know that smoking is the #2 cause of cardiovascular death after hypertension. And even for people who don't smoke themselves, but if you're someone who breathes in secondary smoke, you've got a 25 to 30% risk of developing cardiovascular disease. So, we need to think about these things. If you are living somewhere with someone who's smoking regularly, you had an increased risk. If you are in perhaps maybe an occupational setting where you're exposed to tobacco smoke, for example, maybe if you work maybe in a club or something where people are always smoking, you are at an increased risk. So we need to be aware of these things. And then also, up to 20% of South Africans have smoked before, or they're exposed to second-hand smoke on a daily basis. So there is a big problem, even for people who don't smoke themselves. So physical activity, there's a stereotype that, for you to exercise, you need to join a gym, but really it's not that. Physical activity can be something simple as, just going for a brisk walk on a regular basis, or actually just being active, avoiding a sedentary lifestyle. So in South Africa, 28% of men and 45% of women, they are physically inactive. So that is a big problem, and that leads to risk of cardiovascular disease. And even in adolescents, it's been found that adolescents, they spend at least about a third of them spend at least 3 hours or more each and every single day watching TV. And that's where the problem is, when you're just sitting on a couch and not being active, your risk for cardiovascular disease goes up. And only 1/3 of adolescents actually have got sufficient moderate intensity activity levels. So we can see that even in our children, even in the young adolescents, they are also at risk for cardiovascular disease. So an unhealthy diet, so we know that if you've got a high salt intake, or if you've got poor fruit and veg intake, if you've got high and increasing fat intake, or especially what we call saturated fats, and if you've got low milk intake and high alcohol intake, you're actually at risk of getting cardiovascular disease. So this picture here is basically shows a supermarket aisle, and amongst some of the food products that you see there, especially on your left-hand side, these are food products that have got a lot of salt, and we know that salt actually contributes a lot to cardiovascular disease, primarily through hypertension. So we need to watch our salt intake. And you may be saying, actually, I don't eat a lot of chips or crisps or whatnot, but actually it's not just that. As you can see, some of the foods listed there, foods such as bread, we've got a significant salt quantity. Your processed meats, your soups or your gravy powders, or your stocks that we use to add into our cooking to flavor our foods, cereals as well, acha. Many of us like acha. So again, that it's got high salt and can contribute to suffering from cardiovascular disease. So what can we do about all of these? I've given you the facts. I've spoken quite a bit. What can we do? So what you can do is the numbers. There's no way you can prevent cardiovascular disease or its effect without knowing your numbers. And this is very simple. You just get your blood pressure checked, you get your sugar checked, and get your cholesterol levels checked. And this is something that is very simple, that can be done quite easily, quite conveniently. You can go to your local clinic. You can even go to your local pharmacy, your Discam, your Clicks, and they can check those things for you. And you're advised to have it checked every single year. And if they do detect something, they will refer you to someone who will be able to see how you can be treated. Other things that we can do: we can stop smoking, we can have a healthy diet, and we can also exercise. And remember what I said, up to 80% of cardiovascular deaths are preventable by those three: stopping smoking, healthy diet, and exercise. And then once you are diagnosed with anything, what you do is to take your treatment and have regular follow-ups with your health practitioner. So this leads me to the next section on erectile dysfunction. So erectile dysfunction or impotence, approximately 50% of men over the age of 40, they suffer from some form of erectile dysfunction. That is a high figure. More than half of men over the age of 40 suffer from erectile dysfunction. We need to be worried, men, and how we tend to find it. We've got a questionnaire that we give to patients who are presenting with erectile dysfunction. This is a simple questionnaire that helps us to screen, and it tells us how bad that erectile dysfunction is. So just 5 simple questions, and we look at it over the past 6 months, so that it's not just a solitary event. And we ask them, how do you rate your confidence that you could get and keep an erection? Then they score themselves from very low to almost always. We ask them about when they've had erections with sexual stimulation, how often were those erections good enough to be able to penetrate? We also ask about when they're having sexual intercourse, how often were they able to maintain their erection after they penetrated? And also, we ask how difficult it was for them to maintain that erection, to actually complete the activity, and then also as well that when they've attempted sexual intercourse, how satisfactory was that for them. So then based on that, we can now see and restratify where someone is. So you can actually try this for yourself, gentlemen, at home. This is actually called the IEE5 score. And you can actually do your score, and it tells you, once you've tallied your score, that do you have severe erectile dysfunction, or moderate or mild erectile dysfunction. And it can even tell you what to do about those. But I think the important point that we need to take home is that erectile dysfunction, it's a warning call. If you start suffering from erectile dysfunction, know that this is a warning call. And what is it warning you of? It's warning you that there's underlying health conditions that exist in you, particularly cardiovascular disease. So, you know, I get a lot of patients coming to me in my practice, and they'll be like, yo, doc, you know, it's not the same anymore. I'm struggling with my erections, and, you know, and can you give me something to help me? And before I even start thinking about giving them any medications to help them with that, the first thing I do is I do a lot of tests, because it tells me that this person is at a high risk of having an underlying disease that I need to find. And then we also know that men with erectile dysfunction, they've got a 45%, well, they're 45% more likely to experience a cardiac event within 5 years. So this means if you're having erectile dysfunction, your risk of having a cardiac event, being a stroke, a heart attack, is quite high in the next 5 years. So it's a warning call that you need to address your risk factors for cardiovascular disease. So the biggest contributory factor to erectile dysfunction is actually your age. And unfortunately, as men, we cannot do much about that, you know. And I get patients coming to me, you know, you get these 65, 70-year-old Nkulus. I'm like, doc, you know, I'm no longer getting my erections proper. Then you ask them, but Papa, what do you mean when you delve into it? It's like, no, you know, after the second round, you know, it doesn't work anymore. And then you actually think that, but Papa, do you know that you're actually getting old? And for you, that is, for your age, that is actually normal, because there is a natural decline with age. The older we get, unfortunately, gentlemen, we are no longer able to perform as we were able to perform in our youth. So age is the biggest contributing factor. But there's other factors that we can address, and this is where, you know, the things that we need to look at. So diabetes. If you've got diabetes, you're 3 times more likely to suffer from erectile dysfunction, or you'll get erectile dysfunction at an earlier age. You know, your chronic heart disease, your chronic liver disease, your chronic kidney disease, you've got a high risk of erectile dysfunction. If you have the metabolic syndrome, which basically is looking at, you know, how overweight you are, your blood cholesterol, and some of the other, the blood fats, you know, and also your hypertension or your blood pressure. That would, if you have 3 of those, you fall into the syndrome of metabolic syndrome. You know, some people who are on some medications, whether they be antidepressants, antihypertensive medications, antiretrovirals, this can contribute to erectile dysfunction. So if you are taking some of these medications, chat to your health practitioner and see, perhaps maybe your medications might need changing, and that actually might help. And then also as well, recreational drugs, they actually contribute to erectile dysfunction. So this is your alcohol, which many people indulge in. And then the other big one is smoking. Smoking also contributes a lot to erectile dysfunction. So conditions that are associated with erectile dysfunction. So for me, I call these the big 5. And these conditions, you know, when there's erectile dysfunction, these 5 conditions are probably present as well. So that would be ischemic heart disease. That is, you know, those people who get chest pain or suffer from heart attacks, diabetes, high blood pressure, dyslipidemia or high cholesterol, and then depression as well. So these are your big 5, and these 5 conditions, tend to be associated with erectile dysfunction. So in terms of your diet, there's a lot that is spoken about this, especially on the media or on some social websites. So in terms of your diet, it has been found that a Mediterranean diet has been associated with a lower prevalence of erectile dysfunction. And then fruits that have actually been recommended that may help with erectile dysfunction are things such as your fruits, your vegetables, your whole grain products. So this is just generally, this is just healthy foods will help you. And you need to try and limit your excessive intake of red meat, your full fat dairy products, your saturated fatty acids, and your sugary foods. So how do we treat erectile dysfunction? So there's quite a lot of things that we can do, but the first thing that we start with is actually we try and identify the cause. What is the cause? Is there an underlying cardiovascular illness that exists that we need to go and look for? So that is where we start for, because we can worry about your erections, but if your heart is not doing well, it doesn't help you at all. Then we need to modify those risk factors that may exist, whether it's smoking, whether it's lack of activity or no exercise, blood pressure, things such as those. And then also as well, there are certain treatments that we can give. We commonly start with your oral medication, your Viagras, and then it's a whole spectrum of things that we can actually assist patients with. But the first port of call is actually to identify what is the cause. So lastly, I'll be touching on prostate cancer. So prostate cancer, it's very important that every man knows about prostate cancer. So prostate cancer is actually the commonest male cancer in South Africa. So this is the #1 cancer for you men out there that you need to know about. And your lifetime risk of being diagnosed with prostate cancer is as high as 1 in 4 individuals, especially in Black individuals. There's a higher risk. So if you are Black, you've got a high 1 in 4 chance of being diagnosed with prostate cancer at some point in your life. So the prostate gland, this is a small gland that forms part of the male reproductive system. And anatomically, it lies just beneath your bladder. And that is the prostate gland. So every man has got a prostate gland. It's only found in men. Women don't have a prostate gland, so they cannot suffer from prostate cancer. So, in layman's terms, prostate cancer is a slow-growing cancer, which in early phase is asymptomatic, but it can cause significant symptoms as the disease progresses. So some of your symptoms that you get with prostate cancer, mostly you may be asymptomatic. You can get urinary symptoms, and by urinary symptoms, I mean things such as, you're waking up at night more often to go and urinate, to empty your bladder. After you finish urinating, you feel like your bladder still has some urine left inside. Or after you urinating, you find you dribble lots of urine, got lots of drops of urine that come out. Or even your stream of urine, it is no longer as strong. In our department, we talk about, are you able to write your name on the wall as you are urinating? Things that we did as small boys. Or does your urine, as it comes out, does it just fall right in front of you by your feet? It's unable to even reach the urinal properly. And then some other symptoms that can exist, if you've got blood in your urine, or if you've got blood in your ejaculate, you need to be worried about prostate cancer. If you suffer from back pain, then also get your prostate checked. If you have unexplained weight loss that you may be suffering from, it may be a sign of prostate cancer. And sometimes we even get people with prostate cancer who are coming in paralyzed and unable to walk. So that could be some of the symptoms associated with prostate cancer. So your risk factors. So your age is #1 risk factor. And when it comes to your age, those men who are under the age of 40, prostate cancer is very, 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 very rare. And in my 4 years with working with prostate cancer patients, I possibly, out of seeing thousands of prostate cancer patients, probably have only seen 2 prostate cancer patients under the age of 40. So it is quite extremely rare under the age of 40, but the older you get, your risk of developing prostate cancer, it goes high each and every year. So if there's a family history of prostate cancer amongst the males in your family, whether they're coming from the paternal side or the maternal side, you've got a higher risk of developing prostate cancer. Your ethnicity, so those with African ancestry, or those who are black, you've got 1.7 times higher risk of developing prostate cancer, and you are 2.5 times more likely to die from the disease than those who are not black. So it's got a great morbidity, especially in black men. So black men, we need to know a lot about prostate cancer and be checked out. Those who are obese got a higher risk of prostate cancer, and there is a bit of a dietary element linked with prostate cancer. So who should go for a prostate checkup? So if you are above the age of 40, now we are talking to you. You need to start thinking about going for a prostate checkup. So if you're more than 40 and you know someone in your family who has had prostate cancer and may have diagnosed below the age of 65, then you're at a higher risk. Or if there's someone in your family, a first degree relative, this would be something, like a sister, and that sister had breast cancer, then you are at a higher risk of developing prostate cancer. If you don't fit that sort of grouping, for those who are more than age 45, I think if you don't have any family history, if you're more than age 45, start going to check your prostate. And then for those men who are over the age of 80, in general, we don't tend to check for prostate cancer routinely. Why? Because we know that it's a slow growing disease. So if you've got what we call less than 10 years of life expectancy left, then we tend not to bother, because the chances of you having symptomatic prostate cancer is low. You're more likely to suffer from other illnesses and eventually die from other illnesses. So what is involved? So in your prostate cancer checks, so there's a very easy blood test for your PSA that you need to do. And then that helps us to suspect or to know, are you at risk of having prostate cancer? Then we do what is called a rectal examination. As you can see on the diagram there, the physician or the doctor will put their finger up into the rectum, and from there they're able to feel the prostate gland there. You can see it's labeled. And then if any of those two, either the PSA blood test or the rectal examination is abnormal, then the next step is to do a prostate biopsy, where basically we stick a needle into the prostate gland, remove small pieces of meat, and we send that to the lab to see, do they see cancer cells in the prostate. So that is how we check for prostate cancer. So there are a lot of benefits from regular screening. So for you to go for your annual prostate checkup, there's a lot of benefits, provided you're in that age group that we are concerned about, because early detection is key, because a high proportion of prostate cancer is actually asymptomatic. So if we can detect the disease early, that's great, because you're actually asymptomatic, and we can start looking at curing you before you develop symptoms. And there are quite a lot of treatment options that are available for prostate cancer. Okay, so thank you very much. This is the end of my talk. I'm hoping that there'll be a lot of questions that my talk has generated in people. And then I just want to leave you with this quote by Jim Rohn, who was an American entrepreneur and motivational speaker. And he said, "Take care of your body. It is the only place you have for you to live." Thank you.
Thank you so much, Dr. Jerry. That was very insightful. Personally, I've learned a lot, and I can see from the stream of questions that are coming through that indeed there's been quite some information. I wouldn't want to say overload, but I'm sure each and every one of us has been isolating these questions, looking at some of those things that as men are affecting us, and as women, we have either partners, brothers, as well as uncles and fathers that may have been in this situation. And I will just give you a moment to just maybe regroup, and we'll be taking questions shortly. While we are doing so, I will just play something just to allow our audience to celebrate men, since this is Men's Day. So I'll also give you this opportunity, Doctor, to just browse through the questions that are there. And when we come back after this short video, I'm going to start with a few questions that I've identified. And then after that, we will allow some participants, rather attendees, to switch on their mic and say something. Apologies, I'm not sure if it was showing.
It was not showing, sir. Can you please play the video again? Yes, it was not showing.
Okay, just a moment. Doctor, have you managed to end your presentation?
Yes, I think I've stopped sharing.
Okay, let me try.
I think you should be fine if you're about to share something.
Okay, let me try one more time.
Okay.
Okay, so we are celebrating men on International Men's Day, and we're recognizing that all of our men here present and anywhere are very important to us. And here is our celebration to them as champions. Okay, I'm told the audio was not that loud. Okay, in the interest of time, I'll just extend to our question and answer. And I'll start with the first question that I have noted, and this is directed to you, doctor. My dad has diabetes. Does it mean I will get diabetes also? I'll take that again. My dad has diabetes. Does it mean that I will get diabetes also?
Okay, thank you for that question. So it's a very good question. So the short answer to that question is no, it does not necessarily mean that you will get diabetes. However, because you've got a family history of someone that has diabetes, you are at an increased risk of getting diabetes. So with diabetes, we've got two types. We've got type 1 diabetes and type 2 diabetes. So especially type 1 diabetics, this is the type where they tend to get to suffer from diabetes from very early age, from adolescence. That's the one that is more hereditary. And that is the one which would place you at risk if you've got a family member with diabetes, if they're type 1 diabetic. With type 2, it tends to be more related to our lifestyle. So things such as obesity, our diet, lack of exercise, those are the things that would lead you to be diabetic. Alcohol is another one. So yeah, so the short answer is no, not necessarily, but it's more common, more hereditary in type 1 diabetes than in type 2.
Thank you for that question. Before I take a question from from the attendees, I'll also summarize just one from one attendee who says, what is healthy living? What is a healthy living lifestyle? How does alcohol and smoking impact one's lifespan? Since women can't talk, what advice can you give to us to deal with our personal issues or personal stress as a man? I'll take that one more time. What is a healthy living lifestyle? How does alcohol and smoking impact one's lifespan? Since women can't talk, what advice can you give us to deal with our issues or personal stress as men?
Okay, so for a healthy lifestyle, I think in general, for me, and I think this answer is different for every individual, what a healthy lifestyle is, because I cannot define it for you. But in general, healthy lifestyle, it means you are looking at the things that you eat, you're exercising regularly, and then also you are attending to any health issues that you may face as they arise. So in general, that is a healthy lifestyle. And then also with lifestyle, it encompasses a lot of things. It's not just the health. There's also, the emotional aspect to it. There's also, a financial aspect to it. There's a lot of things, spiritual aspects to it, depending on your beliefs and your religious systems. So all these things, they tend to integrate to impact on your lifestyle. So in summary, you can't be defined for everyone, but when specifically looking at physical health, it's really looking at your diet, exercising, not abusing substances which are harmful, and attending to health issues as they arise, and not delaying those issues, And then on the issue of how can we engage on as men, we don't speak, how can we engage? So I think, let's keep it simple. Let's start in our circles, with your friends, in your friend groups, your social circles, talk to the guys in your social circles, because usually those are the guys probably who will listen to you and give you advice non-judgmentally, so talk to those guys, but, let us not be shy to seek professional help, whether it is a counselor, whether it is a health practitioner, a social worker. Let us not be shy to seek professional help. Those people are there to help us. So that is my advice. Like, let's get talking. And there are a lot of things nowadays, or platforms, even on social media, where people are talking about their health issues, even anonymously, that can help him. So I think, we need to break away from that. As men, we don't talk. We need to talk, because we are dying in our silence.
Thank you, Doc. My dad is 67 years. I would like to know what sort of food I can give him in order to prevent sicknesses like stroke, diabetes, and the rest that you have mentioned in your presentation. One more time, my dad is 67 years, and I would like to know what sort of food I can give to my dad to prevent sickness like your stroke, diabetes, and others that you have mentioned in your presentation.
Okay, so it's a good question. Thank you for that question. So the kind of food items or diet that we should be focusing, I think number one, let's look at our salt intake. So let's limit our salt as we prepare our foods. Not to use salt excessively, but also as well, let's look at the type of foods that we are buying. Processed foods have got high salt intake, so we need to avoid a lot of processed foods or processed meats. Your things like polony, those things have got high amounts of salt. So your bacons again. So let's avoid those kinds of foods. And then I think the preparation of our food is important. Food that you cook at home is almost always healthier than taking fast foods. So avoid those kind of fast foods, or don't have them too frequently, because that is not healthy. Look at the type of oils or the type of fats that you use. Go for plant-based oils when preparing your food versus animal-based oils, because those ones can be harmful. Let's look at our sugar intake. So, reducing the amounts of sugar that we take, our fizzy drinks, those kinds of things. And then alcohol as well, that's another one. Alcohol falls under diet, so also limiting alcohol. And then, let's look at eating sufficient amounts of fruit and vegetables, and also whole grain foods. Your things such as your rice, your brown rice is more healthier than your white rice. Brown sugar is more healthier than, white sugar. So your whole wheat bread or your brown bread is more healthier than white bread. So those are some of the things that we can look into integrating into our diets.
Thank you, Dr. Jerry. I'd like to ask someone from the attendees who probably have a burning question that you would like to ask. Here's your opportunity. You can ask something directed to Dr. Mataruka, and we also have another wellness expert amongst us, and that is Ed Masao from Velocity Health. As you are preparing for your question, I would also like to share the toll-free number where you can get some assistance as well for counseling and such as Dr. Jerry has just attested to, where men can also get counseling or have someone to speak to. The number is 0800 014 796, and we will share it also in the chat section here. So do I have someone who has a burning question and they would like to direct it either to our wellness expert or Dr. Jerry?
Yeah, afternoon.
Afternoon, say.
Hi, Gerald. How's it, Doc?
Good, thanks.
Yes, I wanted to find out, you mentioned that prostate cancer is very prevalent in Black men. What are really the reasons behind this? Obviously, scientifically or biologically, I don't know, with the body itself. And you mentioned on all the other areas that these are the things you can do to either prevent and so forth. From a prostate cancer side, are there things that we can do to actually prevent this and, prevent it from actually occurring?
Thank you for your question, Lloyd. So coming to your question, the answer to why prostate cancer is so prevalent in black men, essentially, it's got to do with our genetics. And, you know, there's a genetic basis on why it's common in black men, that it's more hereditary in black men compared to other races, that is white or Asian or other races. So it's got to do with the genes. And unfortunately, prostate cancer for black men is one of those illnesses where we are more susceptible based on our genetic makeup that has been, you know, handed down to us generation after generation. Unfortunately, there's nothing you can do to change that. There are other illnesses which, in other races, which are more common that blacks or black people are less susceptible to. So unfortunately, that's how it plays out. It's got to do with the genes, without going too much into a lot of detail. And then in terms of at looking, what can we change? So in terms of your risk factors for developing prostate cancer. So, you know, if you're to go back and you to just look at the main risk factors, being age, you're unable to do anything about your age. Every year you get older. Your race, you are unfortunately not able to change your race. Your family history, you cannot do anything to change your family history. Those are the three main risk factors that exist for prostate cancer. So in terms of what can you actually do, there's very few things that you can do, and that is probably related to the diet. So there are some things that are beneficial in preventing you from developing prostate cancer, and some things that are harmful. So for example, if you consume high quantities or significant quantities of tomatoes and soy products, those are protective from developing prostate cancer. And then things that are harmful when it comes to diet would be things such as your saturated fats, high levels of alcohol intake, and also high levels of dairy products, especially those with full cream. So those things can be make you more susceptible to developing prostate cancer. But what I do want to say that when it comes to the diet plays a very small role. So in terms of, you can eat all the right things and still develop prostate cancer. So diet only plays a very small role. So I think what's most important is let's go for our checkups, so that, you know, if there's anything, we can pick it up early.
Thank you.
Thank you, Lloyd, and thank you, Doctor, for that explanation. Does someone else have a question? We're open to more questions. We still have a good 10 minutes to wrap up.
Hi, can you hear me?
Yes, sir, we can hear you.
Okay, Simon, yeah. I actually wrote a question to the doctor earlier. I was actually asking about vasectomy. I'm 33 years old, and I think I have enough kids, and I would like to actually go through the procedure. But I'm also scared that is it a hearsay, or if it would contribute towards one getting a prostate cancer? How true is that, and what are the chances for one to get prostate cancer after they have performed the vasectomy procedure? Thanks.
Thank you for that question. I believe it's Simon. So to answer your question, vasectomy has got no role or contribution in your risk of developing prostate cancer. So yeah, so if you have a vasectomy, you're not at an increased risk of developing prostate cancer. So there's nothing wrong with having a vasectomy. It won't affect your cancer risk.
Thank you, Doc. There was one other question that says, how do we cure erectile dysfunction? I think you had mentioned it at some point, but maybe you would like to reiterate. How do we cure erectile dysfunction?
Okay, so in a nutshell, how to cure erectile dysfunction? The first thing is, let's try and identify the cause. The cause of erectile dysfunction is different from patient to patient. So let's try and see, is there an identifiable cause of the erectile dysfunction, and can that cause be corrected? For example, someone who suffered a stroke before, they've got a central cause in their brain causing the erectile dysfunction. And there's nothing you can do to undo that stroke or the damage from that stroke. So in that case, that patient, you already know the kinds of things that you're going to treat that patient with are different. So it's not a one size fits all approach. You look at your patient, try identify the cause. That's number one. Number two is modify your risk factors for getting erectile dysfunction. So these are your lifestyle issues. So if you have hypertension or high blood pressure, control your high blood pressure. If you've got diabetes, make sure your diabetes is well controlled. If you've got high cholesterol, let's address the issue of high cholesterol or dyslipidemia. Let's control that. If you are smoking, you need to stop smoking. If you are taking excessive alcohol, let's stop the alcohol because that is contributing. So you'll find for most people, there's no one single cause. All these things are contributing, they're working together. So you need to address each and every risk factor. So that's step number two, address the risk factors that are identifiable. And then step number three, that's when we start looking at the treatment options after you've optimized everything. So there are certain medications that you can give. So the first point of call would be your oral medications or your Viagras, which are a big group of medications. So you would start there, and then you'd monitor the patient response and tailor it according to the patient's response. And if there's no response, then you can start looking at other things, such as injections into the penis to help with the erections, or there are some vacuum devices that are available. And the last step would be looking at penile prosthesis. So it's actually a spectrum, but you start step by step by identifying the cause, modifying the risk factors before you actually start going into your treatment options in terms of medications or whatever procedures that can be done.
Thank you so much, Doc, for that response. And I've got another question, and I would like also to invite Ed Masao to probably respond to this before we also give you a chance, Doctor, to respond. So the question says, regarding mental health, would you advise that men consider seeing counselors or psychologists even when one has not yet been diagnosed with depression or any mental illness? Regarding mental health, would you advise that men consider seeing counselors or psychologists even when one has not been diagnosed with depression or any mental illness? So maybe this one, before you say something, Doc, I don't know if Ed has something to say on this one. Ed, are you still there?
Yes, thank you, Mason.
Great.
Let me put on my video so that you can also see my face. So the answer to that question is yes. You can see a counselor or psychologist before you have been diagnosed. So here's the reason why the answer is yes. When you are diagnosed with any mental health problems, it means they have gone too far for them to be diagnosed. Now you are at a curative stage where you need to be cured of it. But before that, in wellness, we make an emphasis on what we call preventive measures. So you being able to take care of issues that could lead to mental health problems prior to the onset of manifestation of a particular case is very good for your health. So when you look at or the whole spectrum of wellness programs that we are focusing our attention on primarily, we are looking at preventive issues to then say what could trigger you to get into an issue that could then become a clinical issue where it's diagnosed and you now need medication. And how can we avoid that we get there? So prevention is better than curing. And you notice that it's also cheaper to prevent than to then cure any sort of mental health problems.
Thank you so much, Ed, for that one. I don't know, Doctor, do you have something to add as well?
No, nothing to add. I think Ed responded brilliantly to that one. So yeah, exactly what Ed said. I agree with him. Yeah.
Okay, great. We have just under 2 minutes left. I don't know, do we have another burning question? Do we have another burning question? The slides will be...
sir.
Yes. This is
right, thank you for
Mabuza. Yes, so you can go ahead, sir.
Yes, thanks for the opportunity. Thanks for the opportunity. Doc, I just wanted to find out, in terms of people suffering from degenerative disc disease or sciatica, what is the impact with regards to erectile dysfunction? Is there a correlation or they are totally independent?
Okay, thank you for that question, Mr. Mabuza. So to answer your question, so sciatica by itself is not related to erectile dysfunction, sciatica itself. However, the two may coexist because if you look at the pathology starts in the spine. And what's happening in the spine is that you've got your different nerves that are exiting your spine, going to the different parts of your body, which is either your lower limbs or the nerves that are actually going to your genitals and even to your bowel area. So those nerves that are going down to affect your erections or cause erectile dysfunction may be involved in that process that is also giving you the clinical picture of sciatica. So yes, the two are not involved directly, but they may coexist because the disease process that is causing the sciatica may also involve the nerves that are also going to affect your erections because all the nerves are exiting from a similar point. So that's why that may happen. Yeah.
Thank you, Dr. Jerry, for that response. And now we are just under 1 minute left. And I'll ask at this point to conclude and thank everyone for attending. And I'll give an opportunity to Ed as well as Doc to just give your parting shots as we are on a very special day, the 19th of November, which is a day we are celebrating men internationally. If you could just give us one parting shot each, starting with Ed, and then we have Dr. Mataruka concluding.
Thank you, Mason. I'd like to just say to everyone here present this afternoon to say thank you very much for being part of the webinar this afternoon. We truly appreciate having you and the discussions that we had. My parting shot to everyone is that we need to take care of our health, particularly as men, because normally when you look at health in our country, you notice that women take a proactive role and a leading role in looking after their health, but men, we take it for granted until it's too late. So let's start a culture where we are proactively looking after ourselves, because this is the life we have and we will not be able to repay it when it has been damaged.
Thank you, Ed. Over to you, Dr. Mataruka.
Okay, so I'd like to thank everyone who's joined us today. I hope this was insightful and beneficial for your time. I'd like to thank the guys at Familia for helping to coordinate this, and also the team at Velocity. Thank you very much. So yeah, so my parting shots, similar to what Ed has said. Yeah, so as men, guys, let us prioritize our health. And the information is out there. There are people or organizations that exist that can help you to get empowered, to get information. And yeah, don't delay. If you are concerned about anything, speak to someone, speak to a health professional, speak to a counselor, and they would be able to direct you to the right people so that your health or your wellness concern can be addressed timelessly. So so that's my parting shot. Let's prioritize our health as men, and let's lead healthier lifestyle. And I'm hoping that possibly in the future we can have something similar like this to address maybe specific issues that people may want.
Thank you, Doctor. And just as a parting shot from me, Vumilia Africa is also going to be hosting another webinar tomorrow, same time around 2, and this one will be on an abundant mindset, and will be offered by one of the partners we work with, who is a life coach. So men, I urge you to get help. Our toll-free numbers, which will link you to the counselors at Velocity Health, with 080, I'll take that again, 0800 014 796. And also you can get in touch at info at velocityhealth.co.za, info at velocityhealth.co.za, and you can also reach sales at vumiliaafrica.co.za, or you can also reach us at info at vumiliaafrica.co.za. And remember the Facebook page where you can find Indoda Health and Wellness, or you can check on Instagram, which is Indoda_wellness. We are found on any of those platforms. Thank you all for attending, and I wish you all a happy International Men's Day.
Thank you.
Thank you.
Thank you.